Hello, my name is Erin Kunzman. I'm a dietetics major at the University of Dayton. Today I will be performing a nutrition-focused physical exam on Agnes. Agnes has given her consent to be on video today. My tools I'll be using are gloves to protect Agnes from any pathogens that I may carry and protect myself from any pathogens that she may be carrying. I will also be using a tongue depressor to search through her hair and check her scalp. And lastly, I will be using my phone light today, but really you would be using a pen light. The purpose of this exam is to assess nutritional status and look for signs and symptoms that point to possible malnutrition. We check for possible fat and muscle loss, and as well as fluid status. This includes inspection of your hair and scalp, clavicle, acromion process, scapula, as well as your lower extremities. Are you okay with that?
Yes.
Great. So we start with the top to bottom approach, meaning I start at your head and work your way down. I'm going to start by asking Agnes a few screening questions. Do you follow any special diet or have any dietary restrictions?
No.
Do you take any supplements?
No.
Have you noticed any changes in your dietary intake?
No.
And do you have any questions before we begin the exam?
I do not.
Great. The next part of this exam will be the inspection of the hair and scalp. I will be using a tongue depressor to inspect her hair and scalp while lifting small sections of her hair at a time, looking for any abnormalities. Is that okay with you?
Yes.
All right, thank you. So I'll begin taking small sections of hair, and I'm just looking at the scalp, making sure it's not discolored, have any rough scaly patches. Her hair looks shiny and full. It looks healthy. It does not look dull. If it would, that would be a sign of a deficiency. Agnes's hair was healthy and normal overall. It was not easily pluckable. It was evenly distributed. Her hair was smooth and shiny. Her scalp was without any lesions. Some abnormal findings could be that her hair was easily pluckable or thinning, or her scalp was dry or flaky, which could be a sign of a riboflavin deficiency. Lastly, she could have sores or lesions on the scalp, which could be a sign of a niacin deficiency. The next step of this exam will be the inspection and palpation of your temporal region. This includes me palpating your muscles with my fingers. Is that okay?
Yes.
Thank you. So I'm feeling it is warm to the touch. Can you please clench your jaw for me? The muscle is strong, no depressions, which is a good sign of good nutrition. Now I will be looking at her cognitive function to see if she's alert and awake. She does not look tired, which is a good sign. And I will also be looking at her skin to check for any hyperpigmentation, assess if there's any dryness. She looks well hydrated as well. Can I please touch her face?
Yes.
All right. Her skin has some nice bounce to it. It looks well hydrated. Agnes was alert, oriented, and had normal response to a stimulus during our physical exam. Some abnormal findings could be impaired reflexes, neuropathy, which could be a sign of a thiamine, riboflavin, folate, or B12 deficiency. Weakness or loss of balance could be a B12 deficiency. Agnes's skin was warm and moist, not dry or scaly. It was evenly colored and free of sores and lesions. Some abnormal findings could be that her skin was cold or dry, pallor, which could
possibly be an iron, B12, or folate deficiency. Sores and lesions present could point to a riboflavin deficiency.
So next I'll be looking at her eyes. I will be assessing the color, moisture. I'm going to be looking at the whites of her eyes, which is the conjunctiva. They look moist, no discoloration. Are you wearing contacts?
No,
okay.
I'm not.
Can you pull down on your lower eyelids? They are pinkish red. They look well moisturized. That is good. If they were paler, that would be a sign of iron deficiency. Next, I'm going to check her supraorbital and infraorbital regions to make sure there's no fat wasting. Can I please touch your face? Okay. They feel good. There's no fat wasting. They feel bouncy.
There were no abnormalities found in the ocular region. Even color was found under the eyes, smooth cornea. Her membrane was pink and smooth and moist. Some abnormal findings could be dark circles under the eyes, dry and pallor membrane, which could point to an iron deficiency, and dryness could point to a vitamin A deficiency.
I'll be using my phone flashlight to look inside of her oral region to check for color, texture, and moisture status. This includes her lips, inside of the mouth, tongue, as well as her gingiva. Can you please open your mouth for me, please? Okay, the inside of her mouth looks pink and well moisturized. No lesions that I see. Her tongue looks a nice pinkish red color. Can you lift up your tongue? Great, thank you. The inside of her tongue and underneath of her tongue are good color, and they have the pinkish blue veins protruding from the bottom, which is a good normal sign.
The oral region was free from any abnormalities. Her lips looked moist and pink. No cracks were found around the mouth. Her gingiva was a nice color with no bleeding. Her mouth was free from any sores. Her tongue was pink and free of fissures and looked moist. Any abnormalities could be cracked, dry lips, which could be a sign of iron or riboflavin deficiency. Pallor gingiva could be a sign of iron, B12, or folate deficiency. And bleeding gingiva could be a vitamin C deficiency.
At this point in the exam, I will be assessing, inspecting, and palpating the clavicle, chromium process, deltoid, and trapezius muscle. Is that okay if I touch you and palpate? Great. Okay. The deltoid muscle seems rounded, which is normal. The chromium process slightly protruded, but that's normal in females. The clavicle slightly protruded, but that is also common in female. Trapezius feels taut and strong, which is a good sign that there is no muscle wasting. Next, I will ask you to stand up and place your hands against the wall, and I will be checking your rib region. Okay, they are well protected, not much fat loss in that area, so that is normal. I will be checking her tricep and biceps, so can you please make a 90-degree angle with your arm? There should be about 1 inch of fat underneath. May I touch it? Yes. Okay. So that seems good. There's about 1 inch of fat, and I can feel her muscle in her tricep. And I'll do the same with the bicep. Feels good. The muscle is there. Great. Looks great. That is a good sign that there is no muscle or fat wasting in that area. Okay, now I will assess hydration status in the hand and look for any abnormalities. Can I see your non-dominant hand, please? So I'm looking at her skin. It looks smooth and well moisturized, no lesions or cracks in the skin. Is it okay if I pinch you a little bit? So I'm going to pinch to test for any tenting, and it recoiled very quickly, so that means that she's well hydrated. I'm also going to have you make an OK symbol, and I'm going to palpate the interosseous muscle, and it feels taut and not flat. If it were almost non-existent, that would mean that there's some muscle wasting. Thank you. So I'll check her nails now. Can I see your hand, please? I'm going to press down on the nail gently to see how fast the color returns. Her nails are smooth and the transverse lines look good. They're not spoon-like, which would be cholonychia, and that is a sign of iron deficiency.
There were no abnormal findings when inspecting the nails. They were pink in color, concave, smooth in texture, free from any splitting or cracking. Some abnormalities could be pale nail beds, which could point to a B12 or iron deficiency, cholonychia, which could point to an iron deficiency. Any discoloration in the nail bed could point to a zinc deficiency.
The last step of the exam will be examining the lower extremities. May I touch your legs?
Yes.
Okay, great. We will be palpating the quadriceps to feel for any muscle wasting. They feel taut, which is a great sign. Her patellar region doesn't feel too bony. They feel well protected. The gastrocnemius, I feel the muscle and I feel a little bit of fat, which is great. Lastly, I will check for any edema in the ankles. I'll press with my thumb and wait a few seconds and see the indentation. If she does have any pitting, that would be a sign of hydration status. This wraps up our nutrition-focused physical exam. Overall, Agnes looks great. She looks well nourished and no abnormalities were found. Lastly, do you have any questions before we finish up the exam?
I don't.
Great, thank you.